Hi, my name is Dr. Bill Emper. I'm an orthopedic surgeon at Bryn Mawr Hospital. I specialize in surgery of the knee and shoulder. The most common issue that we see in the shoulder is injuries to the rotator cuff. The rotator cuff is a series of 4 muscles and tendons that come out from the wing bone or scapula, insert on the top of the humerus. They're underneath the deltoid muscle, and unfortunately they do tend to wear down and tear. So it is a common problem that we see in the office, people with shoulder pain as a result of rotator cuff injuries. The treatment options span a spectrum of non-operative to operative treatment for rotator cuff injuries. Oftentimes we'll start off with just some anti-inflammatory medicine and physical therapy, ice at home, and a lot of times that will help patients to a large degree. If, however, symptoms persist, then it may be as a result of having a rotator cuff tear. Rotator cuff tears are often associated with pain but also weakness in the shoulder, difficulty putting your arm in a coat or sleeping at night. If those symptoms persist, then we will order an MRI to see if there is a rotator cuff tear. If an MRI confirms a tear of the rotator cuff, then the treatment is usually surgical. The surgical treatment of rotator cuff problems have changed a lot over the last 10 years. Those of us who do a lot of shoulder surgery nowadays treat rotator cuff tears arthroscopically for the most part. Rotator cuff surgery is done as an outpatient. As I said, most patients are treated arthroscopically through little incisions. They go home that day in a little sling or a little shoulder immobilizer. If it is a rotator cuff repair, it can take a while to heal. The initial period is a period of immobilization with just passive motion, meaning someone else moves your arm for you, and then strengthening exercises begin. This is usually done under the guidance of a physical therapist.